talk. Okay, thanks. Matt will talk about how climate change can and will affect our health. And Margaret will talk about pandemics and climate change. And Martin will talk about the stress on health services from climate change. And this will be about 10-minute presentations. And then we will have time for questions and discussion, and also for your sort of points of view about the issue and what can be done about it. Now I will try something completely new. I tried to start a quiz and what are your interests in this issue. So I will sort of show this. Hopefully it will work. I'm not. Let me just share screen. Let me see. So if you want to give your viewpoint, you could here go to this link up here. Can everybody see the AHA slides? And it's also in the chat. Yeah, so you can sort of see these questions. The first one is, what are your most important concerns regarding global temperature increases and your health? So you can give up to 3 short responses as words or phrases. And if you write them, then they should appear on the sort of screen. So you have now some time, a few seconds to respond. And the second question is, who will be most affected and harmed by the climate crisis in terms of health? So if you want to respond, if you go to the sort of, to this link, and then you can enter your phrases. Or if you cannot do it, you can also write it in the chat, so that people, the speakers will get some idea about your opinion and what you think is most important to address. The third question is, what do you want to learn from our webinar? Okay, this is... Sorry, this is not supposed to happen. Okay, so let me go back. So I stop sharing now. So I don't know whether it worked, whether you could enter this AHA slides and see what sort of responses we get from the different members of our group. And now I would like to pass on to Matt to present his first talk. And as I said, then afterwards, Margaret will talk and Martin, and then we will have a joint discussion. Please, Matt, go on.
Thank you very much, and thank you all for being here on a Saturday afternoon. I know that there are other pressing things to do today. So my name's Matt Sawyer. I'm a GP. I live in North Yorkshire. I grew up in York itself, but I practice a little bit north. But I don't just do medicine. I also do work around the environment, particularly carbon emissions from primary care and carbon literacy training for staff. So actually, there's quite a lot of different health impacts from the climate crisis. And this is a chart that people may have seen elsewhere. It's been used quite widely. And really in the centre, it's got the rising temperatures, weather extremes and rising sea levels, and then starts to think about all of the different health impacts from each of those. But we're just going to have a look at very briefly at a few of them. So we'll look at the heat, we'll look at severe weather, and we'll have a look at air pollution. So really we can start to think about how is climate change and the climate crisis going to affect us here in and across Yorkshire. So this is a projection of sea level rise by 2050, and anything that is in red at the moment or on this is going to be below sea level. So although York itself may not appear on this, actually, when we start thinking about the number of people who live in the Humber Valley and on the floodplains, there are going to be a lot of people who are going to be rehoused and need to move home. So this is actually going to create some climate refugees and people who are going to be rehoused elsewhere. So this is actually a pretty huge area. Now, actually, this is a picture of me on my wedding day. This was a few years ago. This is up in Reeth. It was November, but we've got beautiful skies. And this was at the bottom of the valley 6 months later. This was where flooding had wiped out one of the bridges. And of course, delivering healthcare is very difficult if you don't have road access. So if we start thinking about, can patients get healthcare, can doctors and nurses and health professionals deliver healthcare, it starts to become more of a problem. And these are actually some of the quotes from people at the time of how the flooding had affected them, people who had lost everything, people who emotionally and mentally felt that they were never going to be able to get over this, people who then felt that they had anxiety and almost a PTSD with every single time it rained. Now, of course, living in Yorkshire, it rains quite a lot, and you can imagine how much anxiety people will then suffer from. And this is actually the front page of the Mirror newspaper from Thursday, and this is a mock-up of what would be expected in the shambles in York, and how much of York itself is going to be underwater. Now, I mentioned, I touched on some of the mental health impacts of flooding. And really, when you start talking to people, it is about loss, it's about distress, it's about breakdown of routine, breakdown of access to healthcare, breakdown of family and support units. It's about isolation, it's about fear. And certainly studies have shown that if people are flooded, then they are much more likely to have depression or anxiety or PTSD as a result. So the worse the climate gets, the worse that storm damage gets, the worse that the flooding is, the more ongoing mental health problems we will be enduring. So what about heat? Well, actually, a similar sort of latitude to York, Leeds. It said the climate could be a bit like Melbourne's in 2050. Doesn't that sound delightful? It is, until you realise that actually the Australians dread their long, hot summers. And certainly when you start thinking about some of the health impacts of heat, that the heat wave that happened in August 2020 had associated 1,700 deaths with it. We also know that people are more likely to turn up to accident and emergency departments, that the risks of dying from strokes and respiratory disease goes up with every single temperature rise, 1 degree C temperature rise. We also know that there's effects for the police because there's more physical violence with rising temperatures. We know that there's effects on the fire service in terms of fires. So actually all of the emergency services start to suffer and struggle. So that sounds a bit of doom and gloom, but actually what could I do? What could we do to start trying to mitigate some of these things? Well, this is a thermal image of a hot day, and this shows the difference at the bottom of the screen in orange. This is the temperature without shade of 61 degrees and the temperature in shade of 34 degrees. Now, both of those are high numbers, but actually the difference of having shade, the difference of having trees and having tree cover within towns and cities where we live is vast. So on the one hand, I'm delighted for tree planting and making forests and making woodlands, but actually I want tree planting in towns, cities and villages where people live and where people will benefit from it, because this is on an hourly and a daily basis for people. The next is just to touch on air pollution, and we know that long-term exposure to various gases affects lung function in children, respiratory infections, effects on adult lungs, dementia, glaucoma, and a whole host of other impacts. We know that it's responsible for worse educational attainment in children. So children who grow up next or go to school next to roads which have got a high degree of air pollution do worse in their exams, even when you take out all of the other factors. So air pollution has a huge impact. And actually, because this is York Environment Week, This is the map of York, and the bits in red are the places with particularly high levels of nitrogen oxides. The bits in dark orange are the ones that are almost as high. Note that there aren't any purples or blues or even greens on this map, apart from one small square outside of the ring road. So again, what could I do? What could we do that would make a difference? Well, actually, there are a lot of resources already available. So this is one, for example, this is Clean Air Hub. They do a lot of great work on trying to raise the awareness of air pollution. They've got a lot of resources, a lot of education, a lot of posters that people can download, put up. And this is something which at street level is can make a real difference to people's health. Just as a, for example, 13% of global asthma is caused by traffic fumes. If we didn't have traffic fumes, we could reduce the amount of asthma by 13%. So we collectively as society are causing some of these illnesses. So that sounds a bit of doom and gloom, but actually there are things that we can do about each of them. But what happens if we as a country met our current climate commitments? This isn't about doing something additional in the future. This is just doing what we've already said that we are going to do. So just roughly, there's between 500,000 and 600,000 deaths in the UK each year. Sometimes it's a bit more, sometimes it's a bit less, but it's thereabouts, just over 500,000. Well, actually, if we met our climate commitments, we could save 125,000 deaths. So this is through changes to our diet, changes to our exercise, and changes to air pollution. If we, as a society, as a nation, agreed to do and put into place the actions that we've already said we're going to do, this is the amount of human health benefit that we could achieve just in this country. This isn't on a national or an international scale. This is just in the UK. So this is from the Lancet. So if I was going to say for people to do one thing, the first I would say is to become carbon literate. Know your enemy, know what we need to do. And the Carbon Literacy Project offer training courses to a whole host of different people. Their contact details are on here. Speak Carbon is a Yorkshire-based training affiliation that does carbon literacy training for people and places and organisations, and there's my contact details as well. So I'm here all afternoon. If people have got questions, please put them in chat. Please stay on afterwards, and I'll do my best to answer them. Thank you very much.
Thank you, Matt, for this very interesting and enlightening presentation. I don't know who would. Margaret, would you like to continue, or Martin? I always ask ladies first.
I think we had agreed that I would go next.
Okay, thank you. Yes.
Thanks, Reinhard, and thanks, Matt, for a very, as always, a very interesting resume of this state of health, the health impacts of climate change. Now then, I'm not seeing my screen as I share it. Is that what, are other people just seeing a black screen?
Yes.
I think I've probably just done it too prematurely. Let's try it again. So,
yeah, now I can see it.
Okie doke. Apologies, it's just getting the right one. Right. So I'm also a GP based near Whitby, GP and GP education. I'm involved in Medact and in fossil-free campaigning, and delighted to be here today. I want to talk about pandemics and the climate crisis. And why am I talking to you about pandemics and the climate crisis? Well, because the very same drivers that are driving the climate crisis are driving pandemic risk. So the IPBES, which is the sort of IPCC equivalent, but for biodiversity, has stated that the underlying causes of pandemics are the same global environmental changes that drive biodiversity loss and climate change. And without preventative strategies, pandemics will emerge more often, spread more rapidly, and kill more people, and affect the global economy with more devastating impact than ever before. So really, this is a call to action about pandemic prevention rather than how we approach a pandemic once it's already established. Pandemics are not new, of course, and anything that disrupts the normal relationship between animals and their pathogens and brings people into closer contact with animals increases the risk of infectious organisms spilling over into the human population. So a very brief 1-minute history on pandemics. Trade and travel and the move to more urban lifestyles, as well as increasing human population numbers, facilitate the spread of pathogens. The plague first emerged in the 6th century and caused 300 to 400 million deaths and the fall of empires. And in the 14th century, the Black Death killed 30% of the population of Europe. But the highest number of deaths were among poorest populations. And also the plague was spread along military and trade routes. Cholera started to spread as a pandemic in the early 19th century at a time of increasing globalization, including the advent of steamships and railways. It is now endemic and causes between 21 and 143,000 deaths a year, despite vaccination and treatment programs. Environmental and climate changes may increase the distribution and favor genetic changes to the cholera organism, and as access to safe drinking water and sanitation is key in preventing the disease, it is also associated with poverty and natural and man-made disasters. And the 2017 outbreak of cholera in Yemen, in war-torn Yemen, is a sad example. Influenza is endemic in humans, birds, and pigs, and pandemics emerge when influenza viruses from these 3 animals resort themselves, bringing into being new influenza subtypes. The first influenza pandemic was probably in the early 16th century. The Spanish flu pandemic, so-called, in 1918 to 19, was facilitated by the devastation caused by World War I and caused 50 million deaths worldwide. And subsequent pandemics this century have been due to the founding 1918 virus combining with reassortments between human, bird, and pig viruses. Anthropogenic changes, so human-caused changes, drive pandemic risk. And these changes are essentially land use changes, globalized trade and travel, and unsustainable trade and consumption of wildlife. The land use changes are deforestation, very important, urbanization, and agricultural intensification. So people are now talking about a pandemic era. In an editorial in The Lancet, it was stated that escaping the pandemic era will require transformative changes and no less than a fundamental reassortment of our relationship with nature. In particular, we must curb unsustainable consumption, which underlies global environmental changes that in turn drives biodiversity loss, climate change, and pandemic emergence. It is estimated that between 631,000 and 827,000 animal viruses could have the ability to infect humans a year, and at least 5 new infectious diseases do emerge every year in humans. Any one of these has the potential to become a pandemic. Now, I just want to comment on the origin of SARS-CoV-2 or COVID-19. The origin of COVID-19 has not yet been confirmed, but the scientific evidence to date supports very decisively the hypothesis that this organism originated in the Huanan animal market in Wuhan. This recent paper, so this paper was published in August, very well researched paper written by the sort of experts in the field, concluding that there is currently no evidence that SARS-CoV-2 has a laboratory origin. So we've heard about the pandemic era, describing, and here's another newly coined term, the pandemic syndemic, which describes how pandemic exacerbates inequalities that in turn impact the course of the pandemic. So the complex interrelationships between these phenomena. And we know that these arguments hold true also for the impacts of climate change. We saw how poverty, overcrowding, and lack of access to clean drinking water resulted in increased cases of plague, cholera, and flu. And so it is also with COVID. As Albert Camus said, pestilence is at once blight and revelation. It brings the hidden truth of a corrupt world to the surface. It is said that we are all in this together, but this is not true. In England and Wales, people from Black, Asian, minority ethnic communities accounted for 34.5% of critically ill COVID patients in April 2020, where 14% of the population of England and Wales are from BAME backgrounds. Between March and the end of June 2020, the age standardized mortality rate for all deaths was 92% higher in the most deprived than the least deprived areas of England, and similar disparities are observed all over the world. COVID-19 has resulted in a widening gap between rich and poor. 500 million people worldwide could be pushed into poverty by the pandemic, in addition to an 82% increase in hunger is predicted. Meanwhile, the world's richest 5 billionaires, ladies and gentlemen, enjoyed a 59% increase in their combined wealth between March and September 2020. At the start of this talk, I said that the drivers of the climate crisis are the same drivers that are driving the pandemic. And so it is with health inequalities too. So an editorial in the BMJ states the drivers of health inequalities are the same political and economic systems that are driving climate breakdown. And so we have a perfect storm. So to sum up, and to explain why it's so important to talk about COVID-19 and the climate crisis at the same time, I leave you with this extract from the 2020 Lancet Countdown report. The need for accelerated efforts to tackle climate change during the next 5 years will be contextualized by the impacts of and the global response to the COVID pandemic. With the loss of life from the pandemic and from climate change measured in the hundreds of thousands, the potential economic costs measured in trillions, and the broader consequences expected to continue for years to come, the measures taken to address both of these public health crises must be carefully examined and closely linked. Health professionals are well placed to act as a bridge between the two issues. Thank you.
Yeah, thank you, Margaret, for this very enlightening talk about the link between pandemics, our climate crisis, and our health, and how it will affect us. So without further ado, I pass on to Martin, who will talk about the stress on our health services from climate change. All over to Martin, please.
Okay, I'll try and make sure I can share the screen. Say I'm a retired public health doctor, and so my main contribution is to keep asking the question, what if and why? I think I probably drove my parents mad as a 3-year-old asking why, and I'm still asking the same question. I really must grow up. Anyway, let's see if I can get this to work. Cross. This. I'm not sure. Can you see anything? Have I messed it up?
Yes, we can.
Yes.
Right. Hopefully. Yeah, and it's occupying this. Hopefully, it's occupying the whole screen. But consequence.
It's not actually, Martin, but maybe that doesn't matter.
I try again. Sorry. May as well try and get it right if I can.
If you
Am I showing the wrong screen? Hang on. I will stop that and I'll just start again. Does that look a bit better?
Yeah, that's great.
Okay, right. So I'm essentially saying health services are what most of us look to if we're unwell and if we're looking for both proactive services that maintain our health or do something about helping us when we're sick. We'd like to try and make sure that they are operational. And climate change is going to place increasing challenges on us. There's a whole point about saying we've got to work out what can go wrong with different consequences of climate change, because if we don't know what can happen, we can't plan to do anything about it. And failure to plan is planning to fail. We've really got to keep asking if we're responsible for any health services or the health of our own family. Forget anything to do with the NHS, forget formal and organized services. Your health depends on what you can do for yourself, what happens within the household, and what happens in your immediate neighborhood. And if we have serious disasters, serious problems, some of which may be driven by climate change, your health and the health of your family will depend on what is being done by people who are close, physically close to you. I just draw your attention to the Japanese, who have recently started working with the equivalent of their neighborhood watch groups to say, well, if we have an earthquake, who will know you're in the house? Who will know which door to get you out of? All the questions about your survival depend very much on what happens or with the actions of people within a few hundred yards. But the more we can plan, the more likely it is that we're going to get it right. Or at least we can limit the damage. Lots of issues around people. The general population, and we've heard from Matt, some of the health issues that arise when we get too hot, too cold, too wet. Well, the general population is going to demand more health services. There will be an increased level of demand on a service. That could be problematic to meet with the existing staff, let alone what will happen in more serious problems. And obviously climate change can come in two ways, or at least two broad ways. One is it's a tidal wave and suddenly we have a problem we didn't know about yesterday, but we've got it today. And the other is the sort of the slow rise that takes months, years for something to happen. Matt showed us that diagram or that map of Yorkshire with all the flooded areas, or the areas that will be wet, will be part of the sea. That won't happen overnight. That will happen over a period of years to take us to that point. So either way, we've got to be ready for things that happen suddenly and things which may take us by surprise because it's happening slowly. Whatever we do, whatever the situation, we're likely, if it's major changes to the climate, will result in population movement. And those movements could be, well, the people who were living in Hull will have moved, they will have come to the west or to the north or the south, migrating within the UK. Clearly, there are already pressures, all the questions about why are so many people wanting to come, the immigrant issue, people are having to leave some parts of the world because they're no longer sustainable. And so the pressures to migrate both within country and across national boundaries, those will increase. And as climate change goes on, that is a bigger and bigger issue. But a displaced population, even when we get a short-term sudden displacement, suddenly people have been injured in those movements. People don't have their tablets or whatever their prescribed medicines, don't happen to have them with them. They didn't grab a copy of the last prescription. They can't remember what they had. They may have to use different languages to access services. They may not know where services can be accessed because they've been moved into a new location. And even if there are services there, they may not know about it. So there's a whole big issue about migrating populations, and they may well have additional morbidity, probably have a higher mortality, a higher death rate, and their ability to access service. The staff who provide services are not going to be immune. And so if thank you. So if the services, thank you, thanks a lot. The number of the staff we've got to provide the health service may well be affected and impacted by the climate change themselves. There's no reason to believe if the rest of the community is being affected, staff are not going to be immune. So we have to expect that we will have fewer staff who are able to provide the services, although the demand for service will have increased. The process is all the way we do things. And one of the factors which I think we often seem to overlook is the training. We try and train doctors, nurses, paramedics, a whole range of people to provide health services. But if we are all disrupted in one way or another by climate change, that training may be disrupted and the training may no longer be appropriate. So, we thought we were training people to deal with a lot of cardiovascular ill health, but following perhaps an increase in flooding, we're actually trying to deal with diarrhea. So there may be quite a sudden change in what we need to be training people for, and that very training may be disrupted by the whole process. Virtually every service we provide has a process. There's a way of inviting patients to come to the GP or to go to the hospital, arranging ambulances. All of those processes are likely to be disrupted. So there's a whole question about, can we actually continue to run the services we were? And the answer is almost certainly it's going to have to change. And it might be a short-term sudden change to deal with a short consequence, but likely we're going to have to be working up a much more flexible way of working in future. As the services we're providing may no longer be appropriate for the new needs. The capacity of the health service is likely, health services, not just in the UK, but around the world, are likely to be exceeded. And what I've put down as hygiene factors, well, whether it's too hot, too wet, too windy, all of those will contribute to basically the spread of mess and muck where we don't want it. So keeping places clean when you have suddenly large numbers of people, and I have worked in the refugee camps in Bangladesh, they are not the most hygienic places, the best one in the world, and it's extremely difficult to try and maintain it. And you don't have the staff, you don't have the necessarily even the mops and the buckets and the disinfectants and all the rest of it that you want. So real challenges. And the supply, I mean, I think we're hearing now about difficulty in the supply and the logistics in the UK with a shortage of lorry drivers. All of that will be exacerbated manyfold as we see as we see serious consequences from climate change. And so we had problems for people, with the processes, and then the equipment. Well, equipment is the things. Our buildings may be in the wrong place for what is now needed, or the location of our hospitals, of our health centres, of our clinics, of our GP practices. They may be in places that are no longer accessible, or other things that make them vulnerable. We certainly saw in Germany, when they had the flooding not so long ago, a lot of health services literally were washed away. But that didn't necessarily mean the demand for them was washed away. So there's a whole issue there with the buildings. Vehicles. I don't think we actually appreciate just how much we now use vehicles to allow us to do things, but many vehicles may be, again, in the wrong place, may have been damaged or lost. We may have problems in actually maintaining them, in getting the fuel for them. All of those are going to make it difficult to use them to provide services. And when I put down small items, well, a hospital bed is a relatively small item. A syringe, a thermometer, a stethoscope, all of those are items that may be affected by the consequence of climate change. And if climate change means we've suddenly lost water, we've lost electric power, we will have a problem in using most modern health service equipment. The supply of batteries may disappear, and an awful lot of minor equipment is battery powered. And if we lose the batteries, we've got problems. Even the loss of electric power may mean we're trying to work in the dark. And having had the experience of delivering babies by candlelight, I can assure you it's not necessarily, it may sound all very romantic and nice. It's not quite as easy as it should be. But really every part of the way we provide health services is vulnerable to the consequences of climate change. And the call really has to be both for general members of the public as well as health professionals, the civil service, is to actually think it out before it happens. Let's plan for how we cope when we have that rise in water, the excessive wind, the loss of this, the loss of that. Let's actually have plans in place so that we can mitigate the consequences and continue to provide services. I'd be putting the plug or waving the flag for doing whatever we can to empower people to provide their own health care for themselves and their families and their immediate communities, because those are going to be the people you're going to most rely on when other services are in difficulties. And that happy and positive thought about the value yourself, value your family, value your community, you will depend on them. So over that, I will pass back to Reinhard. And I'll stop sharing the screen.
Okay, thank you, Martin. Thank you, Matt. Thank you, Margaret, for your very interesting and revealing presentations about health and climate change and how it will affect us. So I think there were some comments in the chat, but before I come to the comments, are there any personal comments people like to make comments or ask questions to the presenters? Please raise your hand either through the reaction screen or just show on the screen and raise your question. Okay, there's one. Martin, yes, please. I don't know whether you can unmute yourself. Yes, you have. So, okay.
Thank you, Reinhard, for letting me.
Please go ahead.
Yes, so I think we're talking a lot about adaptation rather than mitigation, quite understandably. To my mind, there's mitigation, adaptation, and what we might call deep adaptation, which starts, as I'm sure you're aware, with the assumption that we cannot adapt. We cannot maintain anything like the way of life that we've become used to. And I'm personally, after kind of worrying about these issues for the last 30 years. I work in international public health, and my first paper on climate change and malaria was written in about 1995. My conclusion at the moment is that climate breakdown is inevitable. And what does that mean? And to me, what it means is it's an emotional response, really, or a spiritual response. It's about, I suppose this would be part of what some people might call the Great Transformation. We have the idea of being grateful for what we've had, grieving for what we're losing, looking after each other as much as we can, and never giving up hope. So that's my kind of starting point now for this. I guess I'll stop there.
Okay, that's a statement. I don't know whether it was meant as a question. I mean,
you're right. It was a statement. It started off going to be a question, but it seems to have stopped being a question.
I mean, yeah, maybe some of our speakers. I mean, I thought it probably was you who also said that climate breakdown is inevitable, and it reminds me of a recent survey among young people, where more than, I think, 55% are very depressed over their future because they have a very similar perception. I don't know whether Margaret, Martin, or Matt want to comment on this.
I mean, I think what Martin's saying is, as you said, it's a sort of fairly deep level, your response to the crisis in which we find ourselves. And I don't think that any of us speakers here are more of an expert on how one should respond to this than anybody else in this call. So I'd be quite keen to hear from any of the participants, reaction to what Martin said.
Any volunteer? So I don't know.
Yeah, Susan,
Susan.
I am. Yeah,
Yes.
I added my name to my husband's, and so we have a very long name now. Yeah, I understand what Martin's saying. I feel that for the next generations, okay, we can't give them false expectations, but we have to, I mean, either they are going to live their life as best they can and assume they're all climate activists, or they're going to give up. So I think there are things that we can do. I mean, Martin's saying, that on a health level, maybe the way is that, you have to think more about actually looking after your own health and those around you, including your family. So that is a positive thing that people can do, and is perhaps a shift from how most of us will have perhaps thought, certainly in the UK. So that's me just starting, really.
Okay, Susan, thank you. I mean, I just take my privilege as a sort of moderator and would like to say that I think, in my opinion, nothing is inevitable until it happens. And I think there is still time to change. But I think personal change is very important and I think helpful. But I think we need structural change, which is more difficult to achieve, and that can even lead to more frustration in terms of, I think, as mentioned in the chat, fossil fuel consumption and our mode of traveling and using sort of high energy tools such as aeroplanes and which all rely on fossil fuels, and cars to go from A to B. So it's very difficult, as we can see at the moment, with airport expansion and the discussion around fossil fuels, to change it. And but I think that is, for me, the main lever in order to achieve significant change. But maybe others would like to comment and say something on this as well.
Could I come in again?
Yes, if there's nobody else, Martin, please go ahead.
I was what I do is health impact assessment, and yesterday I was on an interesting call. There's a a village in Wales, which is due to be the first village which has to be abandoned with rising sea levels. And that's going to happen over the next 40 to 50 years. The decision has been made that that has to happen. They can't build a wall around it to keep the sea out and the river out. And so the discussion is about what kind of planning now has to go in place for those people in that village, where there is not going to be compensation for their financial losses, because the resources to compensate by buying out people's homes for 1,000 people is just not there. So that's the first time I've come across that particular discussion of making those next steps, and I thought that was rather interesting. That's just yesterday.
Again, I mean, I would just like to comment when somebody says the resources are not there. I think if states can build how many new nuclear submarines and finance wars over 20 years, nobody can tell me that resources are not there. It's a question, I think, of political will, but it's also a question of political pressure, whether we want to exercise this pressure to address and demand that the resources are there. Because the resources, we have an enormous amount of resources, in my opinion. It's just a very unequal distribution, how Margaret has highlighted, and I think that needs to be addressed if we want to do something about climate crisis. Any other comments, questions? I mean, and in the chat, there was a comment about capitalism makes planet and people sick. I don't know whether anybody would like to say something about this. There was another comment about population increase we have experienced and meat consumption increase, which are sort of two issues. Anybody who would like to say something? I can see Gwen. Yes, please go ahead.
Yes, I think that we're really looking at emotional responses as well as practical responses, and that's fine. But I think we have to act now. We have to make sure that those widespread polluters actually stop taking fossil fuels out of the earth. They make sure that they look at profits and stop putting profits before people, and in this case before the earth and the survival of the earth. You know, we need to make sure that these people step up. These dirty industries, they can be taxed out of existence. We know that the billionaires have made more money during this pandemic. They will continue to make money from the earth because they deal in short-termism. They deal in capitalism. And what we've got to do is change the system. We've got to change it pretty fast. And it doesn't seem to me as though the governments in this country, particularly the government in this country, has got the will to actually start the change. And I find it all depressing, but I also find it alarming. And I instead of sitting back and saying, well, we've all got to look after ourselves and so on, I'm cross, I'm angry. And I think it's time that things were done. And if it means changing a government, if it means changing a system, then, you know, let's have some cooperative way of coping for now and looking to the future so that we can cope in the future.
Yeah, thank you, Gwen, for your radical contribution. I just want to add some comment. I mean, the problem is when I like young people say system change, not climate change, that I get sort of some feedback where people say, oh, this is pretty radical and we should not be so radical in order to advance the issue. So yes, I just put this into our discussion. And
it's pretty radical to lose the earth now, isn't it? And I'm not a young person.
It is indeed, and it is indeed. And I mean, next week on Sunday, not this Sunday, there will be elections in Germany, and there is a satirical party called the Party, which says we cannot destroy our economic system just to save our planet. So I think that points to, I think, our actual reality. But I would like to pass over to Debbie she has sort of raised her hand. Please, Debbie, go ahead. What would you like to say?
Hello. Yeah, well said, Gwen, first of all. And I put in the chat that, you know, capitalism makes us sick. I was thinking of things like it makes us fat, it sells us crap, it doesn't house us properly, it creates inequalities, it provides shitty jobs and then doesn't pay people properly for them. And so I would hate capitalism whether or not there was climate change, if you see what I mean. And when I watched a video called The Story of Stuff, I thought, oh, yeah, of course. Here's a whole another reason to hate capitalism, because it takes you through the story of products and extractivism and crappy jobs in factories, because, you know, and all the rest of it. And then my students used to watch the bit where it says, you go to work and you come home and you're tired and you switch on the telly and the telly tells you you suck because you're not wearing the right sort of shoes or you haven't brought the right kind of product. So then you have to go shopping and then tomorrow you have to go to work to pay for it and you've got no space in your house and it all goes to landfill and we need a circular economy, you know. So I'm angry about capitalism like Gwen is, and I'm a bit kind of, I wasn't expecting a Medact show to be entirely so doom and gloomy, because I know that you campaign very strongly for justice, for health as a human right. And I didn't know you were going to come along and start York Environment Week by being so miserable.
I mean, that is why we have the discussion. Now we don't need to be miserable. We need to say what needs to change and what we can do. And I think the problem for me, again, a bit of a provocative remark with the term capitalism is that there are many different understandings and it doesn't really help that much. I mean, besides describing the actual system, but what is the key of the system, economic system, which needs to change, and in order to address the problems of injustice, but also of the climate crisis. And I pass on to Martin. I think he has, I don't know, Gwen, did you want to say something again, or your hand is still raised? I think it's still probably raised. Martin, please go ahead.
Just very briefly, we may, or I may have sounded very dark and gloomy, but I'm saying if we can recognize the problems, we have opportunities to do the mitigation, to plan for them, to deal with it. If we don't want to see what's coming, we're going to be in a very difficult situation to respond. So let's actually be aware, ask the question tomorrow morning, at home, in my neighborhood, in my workplace, what if, and have some idea about what you would do and how you do it. And if necessary, talk to others. There's something called empowerment. Let's actually know how we'll respond. And you can take a positive tune to it. Well, I hope you can.
Thank you, Martin. I think Margaret wants to say something. I want to raise a question as well. I'm in a discussion with several sort of deniers of climate crisis and also COVID. And maybe at one time we can say, is it worthwhile discussing with them and trying to convince, or is it better to ignore them? But please go ahead, Margaret. And
yeah, Debbie, apologies for sounding so doom and gloom, and you're absolutely right. And really what Medact's all about is campaigning for, if you like, a better world. And I think that what we often talk about when we talk about the links between health and the climate crisis is that actually the co-benefits of addressing either impacts the other. So we've been talking about eating meat. Reduced meat eating has huge benefits for the planet and also for health, similarly with active transport and so on. So there are loads of positivities here. And can I just quickly share one slide to hopefully cheer everybody up? So I hope you can all see that. I can't make it bigger, but you can all see that anyway. I'll stop sharing now. And I think that's my sort of basic philosophy.
Yeah, thanks, Margaret. So this gives the whole a positive spin. Heather is supporting it, and I think Martin wants to say something. Yes, please go ahead, Martin.
Yes, it's hard to believe that there are still any climate deniers around, but of course there are. If you haven't seen it, there's a very good MOOC. You know what that is? A massive online course, freely available. It came from the University of Queensland, which is about the science of climate denial. So it helps one to understand where climate denial people are coming from and where the flaws in their arguments lie. And I would strongly recommend it if you still have to interact with climate denial people, which I'm glad to say I don't anymore.
Yeah, I agree. I mean, the point, my question is, I don't think there is much to do in terms of, I think, to try and have a rational argument. The question is whether to ignore or whether to try and address the emotional aspect. I mean, maybe because I'm from Germany, and certainly during the Third Reich in Germany, there were some conspiracy theories which strongly motivated people, and people believed in it, and which had very serious consequences. So that's why I'm very interested in this topic, and also today to see these denials. Who else would like to contribute? I mean, we have got 5 o'clock, so this was the official time, but I do not want to sort of completely sort of stop unless people say we are tired, we had enough, and we would like to think about it. But if you have some other contributions or suggestions, especially positive suggestions to give it a sort of nice end. Gwen, is this a raised hand again? Do you want to speak?
Yes, I think that we can look to 1 Million Green Jobs. That was a publication, and look at the Green Deal and all the things that have been published. And you said yourself, you know, stop Trident, stop wasting money on products that are actually to do with destroying resources, using resources, but also the potential of destroying people and land. So, I mean, I think the positive thing is you can't rely on just families. And as far as deniers are concerned, many of them must be scared out of their wits. I don't know how young people are coping with this, you know, because it is scary. I'm a whole girl and I'm scary for my relatives there. You know, you think of cities being submerged and so on. We have to make radical changes now. You have to make radical changes. And if at the end of it, it means that, oh, well, it wasn't as bad as it should have been, you will never know. Doing nothing isn't an option. It really isn't. And I think there's plenty we can do. We have to get the Labour Party involved. We have to get the other politicians involved. We have to make sure that they look at where the worst polluters are and do something about that. We can't rely on communities getting together and just saying, well, we'll help each other when it comes along. I don't want it to come along in quite the ferocity that has been talked about, because I think that it's not, communities are great, but it has to spiral up to the top. And if the top doesn't give a good example and good strategies and use their financial and natural resources, then, you know, there's no hope for us, is there? So we do have to do everything we can. And instead of saying, well, XR, aren't they silly? You know, they're trying to stop this and they're trying to shut the M25. They're trying to make the point that time is running out. And I think it's very scary. It's about 3 years since we first had the climate crisis acknowledged in York Council, for instance. You know, we are treading water. We're not doing enough. It's all right doing small scale. We'll all do that, you know, but it's got to be large scale, I'm afraid. And we can do it. I think it's positive. We can do it.
Okay, that's a very good point to hear. And also, there was a request to whether the chat can be saved and made available. I think that should be possible. Margaret, you want to say something? Please go ahead.
It's just really, I assume we're sort of coming to the end. And what I wanted to say is Medact is an organisation of health, people that work in healthcare. And if anybody would like to join us locally, they would be most welcome. Medact Yorkshire is more or less who you see here on the screen, and we would be much more active and effective with more people. So please get in touch. And when we send out an email, then please feel free to reply to that and get in touch. If you're able to become involved, we'd really welcome you.
Thank you, Margaret. And I just want to add one point. I think one important point, which is also going to be addressed on Monday, is our financial system, because I think at the moment our financial system is driving to a large extent climate change and sort of investments in the wrong places for the wrong purpose. Martin Bailey, I think, said that there is not enough funds to save this village in Wales, but if investment would, instead of fossil fuels, go into social housing and many other social services, they may be not as profitable as what they perceive fossil fuels are, but I think this could be a big game changer. But I always observe again and again that many people are virtually illiterate about our financial system and how it works and what it does and where their pension funds go. And for instance, I would like to point out this seminar on Monday about the North Yorkshire Pension Fund and where the money goes and what it does. And that is, I think, a very important way to address the crisis, the problems we are facing. Are there any sort of other comments, questions, suggestions? I see Debbie, you raise your hands. Is that, yeah? Okay, please, Debbie, go ahead.
Please, everybody, have a look at York Environment Week. I'm pasting the link to the events for all the different events coming up over the next week or so. And also there are other events in Great Big Green Week to take a look at. So I'd like to thank Medact for taking up my invitation to come and talk to us.
Yeah.
And Margaret, thank you. And do support York and Scarborough, defend our NHS. I've put a link in the chat about that as well. And that's it. Thank you.
Yeah, so I also want to thank everybody, especially the three speakers, and all the contributions and the interesting discussion about the topic. I hope it was not too negative. I think in the end it turned out to be that there is a lot we can do. And as I said, one should never give up hope. I mean, Margaret quoted my most favorite author, Albert Camus, who also lived, he was a doctor, or he was a writer, but in The Plague he wrote about a doctor who also never gave up hope despite a plague in Algeria, and said that we should always struggle to improve our life and make it better. So let's end on this note, and I hope you have got some ideas what we can do, and I wish you all a good remaining Saturday and Sunday, and enjoy the good weather, which is, I think, in Leeds, and I hope you can attend some of the other very interesting events of the York Environment Week. Thank you, and have a good evening, and all the best. Take care.